Cervical spondylosis. Symptoms, causes, risks, and treatment. Cervical spondylosis is a natural aging or damage to the vertebrae, discs, and joints in the neck, C1, C7, leading to pain, stiffness, and related neurological problems. This condition is common in older adults, but can also occur earlier due to lifestyle or medical conditions. Symptoms of cervical spondylosis. Symptoms can range from mild to severe, depending on the extent of degeneration and the structures affected. Common symptoms include 1. Neck pain and stiffness. Dull or sharp pain in the neck, especially when turning or bending the neck. Stiff neck, limited range of motion, difficulty turning the head or tilting the neck. Pain that may radiate to the head, headache, or down the shoulders and arms. 2. Neurological symptoms. Numbness, tingling or weakness in the arms, hands, fingers, due to nerve compression. Electric shock sensation running down the arm when moving the neck. L'ermite's sign. In severe cases, there may be loss of coordination or difficulty walking due to spinal cord compression. 3. Other symptoms. Crackling sound when turning the neck. Fatigue, discomfort due to prolonged pain. Muscle spasms in the neck or shoulder area. Note, some cases of cervical spondylosis have no obvious symptoms, detected by X-ray or MRI. Causes of cervical spondylosis. Cervical spondylosis is the result of natural aging or other factors that damage the cervical spine. The main causes include 1. Natural aging. The discs lose water and elasticity with age, leading to reduced ability to absorb force. The bones and cartilage in the vertebrae wear down, forming bone spurs. The ligaments and joints of the neck become stiff and less flexible. 2. Trauma or repetitive stress. Previous neck injury, accident, fall, impact. Prolonged incorrect posture, looking down at the phone, working with the computer in the wrong position. Carrying heavy loads or performing repetitive movements that put pressure on the neck. 3. Related diseases. Arthritis, rheumatoid arthritis, ankylosing spondylitis. Cervical disc herniation, increasing pressure on the nerves or spinal cord. Congenital abnormalities of the spine, such as congenital spinal stenosis. 4. Unhealthy lifestyle. Lack of movement or lack of exercise weakens the muscles that support the spine, and being overweight or obese increases pressure on the spine. Smoking reduces blood circulation to the discs and bones. Risk of cervical spondylosis. Some factors increase the risk of developing or worsening cervical spondylosis. 1. Age. The risk increases in people over 40 years old, especially after 60 years old. 2. Occupation. Jobs that require sitting for long periods of time, bending the head a lot, office workers, drivers, or carrying heavy loads, construction workers. 3. History of trauma. Previous accidents or neck injuries increase the risk of early degeneration. 4. Genetic factors. Family history of spinal diseases or arthritis. 5. Lifestyle. Bad habits such as using the phone too much, sleeping in the wrong position, or being sedentary. 6. Underlying diseases. Obesity, diabetes, or autoimmune diseases increase the risk of degeneration. Treatment of cervical spondylosis. Treatment of cervical spondylosis focuses on pain relief, improving function, and preventing disease progression. Depending on the severity, treatments include 1. Non-surgical treatment, most common. Lifestyle changes. Maintain correct posture when sitting, standing, working, computer screen at eye level, avoid bending over for too long. Avoid activities that put pressure on the neck, heavy lifting, strong neck rotation. Lose weight if overweight to reduce pressure on the spine. Physical therapy. Exercises to strengthen the neck, shoulders, and back muscles to support the spine. Traction to reduce pressure on the nerves. Massage or muscle relaxation techniques. Medications. Over-the-counter pain relievers, paracetamol, ibuprofen. Muscle relaxants, myorelaxants, to reduce muscle spasms. Non-steroidal anti-inflammatory drugs, NSAIDs, to reduce inflammation. In severe cases, corticosteroids, short-term injections or oral, may be used. Adjunctive therapies. Hot or cold compresses to reduce pain and inflammation. Temporary neck braces to limit movement and reduce pressure should not be used long-term. Acupuncture or acupressure massage as prescribed by your doctor. 2. Surgical treatment, severe cases. Surgery is only considered when there is severe nerve or spinal cord compression, causing muscle weakness, loss of sensation, or failure to respond to conservative treatment. Methods include discectomy and artificial disc replacement, spinal fusion to stabilize the spine, removal of bone spurs or widening of the spinal canal to reduce compression. After surgery, rehabilitation is needed to improve mobility. 3. Prevent recurrence and improve spinal health. Exercise regularly. Yoga, Pilates, or swimming exercises help strengthen muscles and improve spinal flexibility. Avoid sports that put a lot of pressure on the neck, wrestling, heavy weightlifting. Nutrition. Supplement foods rich in calcium, vitamin D, milk, salmon, green vegetables to improve bone health. Drink enough water to maintain moisture in the discs. Quit bad habits. Limit using the phone or computer for too long without resting. Do not smoke, because it reduces blood circulation to the spine. Regular checkups. Monitor your spine health with X-rays or MRIs if symptoms recur. Consult an orthopedic or neurologist if symptoms worsen. Important notes. When to see a doctor immediately. If you have symptoms such as weakness in your arms/legs, loss of sensation, difficulty walking, or pain radiating down your arms with severe numbness, see a doctor immediately to check for nerve or spinal cord compression. Do not self-treat. Avoid using painkillers for a long time or performing strong neck rotations without instructions, as this can make the condition worse. Personalized treatment. Each patient has a different condition. It is necessary to consult a specialist, osteopathic neurologist, for assessment and appropriate treatment. Thank you for watching the video. Wish you and your family good health and happiness.